Welcome back to the channel. Today, we're diving into the 10 indicators of rheumatoid arthritis you should be aware of. Rheumatoid arthritis is a chronic autoimmune disease affecting millions worldwide. It occurs when your immune system attacks your joints lining. This causes painful swelling, bone erosion, and joint deformity. Early detection is crucial for managing the condition and preventing damage. We'll discuss 10 common indicators of rheumatoid arthritis. This video is for informational purposes only. Consult a healthcare professional for proper diagnosis and treatment. Let's get started. One of the earliest signs of rheumatoid arthritis is persistent joint pain. This isn't your typical wear and tear pain. It's a persistent ache, tenderness, and stiffness in multiple joints. Often, it first appears in the smaller joints of your hands, wrists, and feet. You might find it hard to make a fist, grip objects, or walk comfortably. The pain is often worse after inactivity, like in the morning. This is known as morning stiffness. Along with joint pain, you might experience noticeable swelling in the affected joints. This swelling is a key indicator of inflammation, a hallmark of rheumatoid arthritis. The affected joints might feel warm to the touch and appear larger than usual. This swelling isn't just cosmetic, it can actually limit your range of motion and make everyday tasks difficult. You might find it challenging to bend your fingers, turn doorknobs, or even button your shirt. Morning stiffness, as we touched upon earlier, is another common symptom associated with rheumatoid arthritis. It's that feeling of tightness and reduced mobility in your joints after a period of rest. This stiffness can last for an hour or even longer in the morning and can be particularly bothersome after periods of inactivity throughout the day. If you find yourself struggling to get moving in the morning or after sitting for a while, it's essential to take note. Rheumatoid arthritis is often accompanied by persistent fatigue that goes beyond just feeling tired. We're talking about a deep exhaustion that doesn't improve even with adequate rest. This fatigue can significantly impact your daily life, making it challenging to concentrate, stay motivated, or even perform simple tasks.
You might find yourself needing to take frequent breaks throughout the day or feeling completely drained even after a full night's sleep. This overwhelming fatigue is often caused by the body's immune system constantly attacking its own tissues, leading to chronic inflammation. It's like your body is constantly fighting a battle within itself, leaving you feeling depleted. If you're experiencing persistent fatigue that disrupts your daily life and doesn't improve with rest, it's essential to bring it up with your doctor. Don't brush it off as simply being too busy or stressed. It could be your body trying to tell you something more is going on.
Chapter 4. Fever, a sign of systemic inflammation. While not always present, a low-grade fever can be an indicator of rheumatoid arthritis, especially in its early stages or during a flare-up. This fever is a sign of systemic inflammation, meaning the inflammation caused by rheumatoid arthritis isn't just limited to your joints. You might experience a slight elevation in body temperature, usually below 101 degrees Fahrenheit. This fever might be accompanied by chills, sweating, or a general feeling of being unwell. It's important to remember that fever is a common symptom of many conditions, so it's not a definitive sign of rheumatoid arthritis on its own. However, if you're experiencing a persistent low-grade fever along with other symptoms we've discussed, it's essential to consult your doctor. Chapter 5. Loss of appetite. When eating feels like a chore. Rheumatoid arthritis can also affect your appetite, leading to a decreased desire to eat or a feeling of fullness even when you haven't eaten much. This loss of appetite can be attributed to several factors, including chronic inflammation, pain, and medication side effects.
When your body is constantly battling inflammation, it can disrupt your normal metabolic processes, including your appetite regulation. Additionally, the pain and discomfort associated with rheumatoid arthritis can make eating an unpleasant experience, leading to a reduced desire for food.
If you're experiencing a significant decrease in appetite or unintentional weight loss, it's crucial to discuss it with your doctor. They can help determine the underlying cause and recommend strategies to manage your appetite and ensure you're getting the nutrients you need. Chapter 6. Weight loss, an unintentional side effect. Unexplained weight loss, especially when combined with other symptoms, can be a concerning sign of rheumatoid arthritis. This weight loss often occurs unintentionally and might be gradual or sudden. The chronic inflammation associated with rheumatoid arthritis can increase your metabolism, causing your body to burn calories at a faster rate than usual. Additionally, loss of appetite, as we discussed earlier, can contribute to weight loss. If you notice you're losing weight without making any conscious changes to your diet or exercise routine, it's essential to bring it up with your doctor. They can assess your overall health, consider other potential causes, and determine if rheumatoid arthritis might be a contributing factor. Chapter 7. Nodules under the skin, a visible sign. In some cases, rheumatoid arthritis can manifest with firm lumps under the skin, known as rheumatoid nodules.
These nodules are typically painless and develop under the skin near affected joints, most commonly around the elbows, fingers, and knuckles.
Rheumatoid nodules occur when the inflammation associated with rheumatoid arthritis affects the lining of your joints and sometimes extends to surrounding tissues.
They can vary in size from a small pea to a walnut and might feel firm or rubbery to the touch.
While rheumatoid nodules themselves aren't usually painful, they can become tender if they rub against clothing or shoes.
If you notice any unusual lumps or bumps under your skin, it's essential to have them checked by your doctor to determine the cause.
Chapter 8. Redness and warmth, visible signs of inflammation. Inflammation is a key characteristic of rheumatoid arthritis, and it often manifests visibly as redness and warmth around the affected joints. When your immune system attacks the lining of your joints, it triggers an inflammatory response, causing blood vessels in the area to dilate. This dilation increases blood flow to the affected joints, leading to redness and warmth. The affected joints might also feel tender to the touch. The severity of redness and warmth can vary depending on the level of inflammation. During a flare-up, you might notice more pronounced redness and warmth, while during periods of remission, the symptoms might subside. Chapter 9. Joint deformity, the long-term impact. Over time, if left untreated, rheumatoid arthritis can lead to joint damage and deformity. This occurs because the chronic inflammation associated with the condition can erode bone and cartilage within the joints. As the cartilage breaks down, the space between the bones narrows and the bones may rub against each other, causing pain, stiffness, and loss of mobility. This can lead to joint deformities, making it difficult to perform everyday tasks. The hands are particularly susceptible to deformities in rheumatoid arthritis. You might notice your fingers start to deviate towards the pinky side of your hand, a condition known as ulnar deviation. It's important to remember that joint damage is often irreversible, which is why early diagnosis and treatment are crucial for preventing or slowing down the progression of rheumatoid arthritis.
The long-term impact of joint deformity can be really challenging. I noticed my fingers starting to deviate and it became difficult to do simple tasks. It's why early treatment is so important.
Chapter 10. Symmetrical symptoms, a key characteristic. One of the hallmarks of rheumatoid arthritis is that it typically affects joints symmetrically. This means that if one wrist is affected, the other wrist is likely to be affected as well. This symmetrical pattern of joint involvement helps distinguish rheumatoid arthritis from other forms of arthritis, such as osteoarthritis, which often affects joints asymmetrically. So, if you're experiencing joint pain, swelling, or stiffness on both sides of your body, it's essential to seek medical attention. While symmetrical symptoms don't always indicate rheumatoid arthritis, they warrant further investigation to determine the underlying cause.
I noticed that both of my wrists were affected at the same time. It was one of the signs that led me to seek medical advice. Symmetrical symptoms really helped in pinpointing the issue.
Outro: understanding the signs, taking charge of your health. Thanks for watching. We've covered a lot of ground today, discussing 10 important indicators of rheumatoid arthritis. Remember, early detection is key to effectively managing this condition and preventing long-term damage. If you're experiencing any of the symptoms we discussed, don't hesitate to reach out to your healthcare provider. They can assess your symptoms, provide a proper diagnosis, and recommend the best course of treatment for you. Your health is your most valuable asset, so stay informed, be proactive, and take charge of your well-being. If you found this video helpful, don't forget to like, comment, and subscribe for more health tips and information. Stay healthy and take care.